My name is Jessica Malaty Rivera. I'm an infectious disease epidemiologist and science communicator. As an epidemiologist, vaccines work. Vaccinations save lives, and we don't have to live in a world where children die of vaccine-preventable diseases. I'm a mom. I have 3 young children who rely on their communities to make good choices for themselves because we don't live in a world as individuals. We live in a world with communities that are very interconnected. So I think it's important for me to protect them and for them to protect their peers. So putting myself out there is my sense of duty to love my neighbors. Information is of the utmost importance. If we don't have accurate information, we don't have trust. And without trust, we can't have people making good choices for themselves or their communities. So misinformation is nothing new. It's been swirling around vaccines since the beginning of vaccines, since the days of the smallpox vaccine. When it comes to finding trusted messages, I look for trusted messengers. So I check CDC, I check WHO, I check colleagues in the space who understand the science and the function of things like vaccines and immunology, and make sure that I repeat the research so that I'm getting consensus in what I'm looking for. So the federal government has been investing in global immunizations for years, and we know that when you invest in public health, that investment actually saves money and it saves lives. And saving money and lives is absolutely worth this upfront investment that we're asking our representatives to push forward, because saving on public health is helpful for the entire world, not just all of us here in the United States. We are talking about a tiny, tiny fraction of the federal budget, literally a fraction of 1%, and that 1% is what's allocated for foreign investments. We're talking about less than that 1% allocated for global immunizations. And we know that when you save lives through vaccinations, it impacts whole communities, whole countries, an entire planet. I couldn't think of a better event to attend after spending almost 3 years not attending in-person events, to come here on Capitol Hill and talk to my representatives about the importance of global vaccines. It seems like just the best re-entry into being back in person. I feel optimistic about going to the Hill tomorrow, considering who my representatives are. I understand that California doesn't represent the entire country, nor does it represent the entire world. So I know that these small conversations can have much more global impact. So I'm excited to be a part of starting those trends. I hope my followers understand that this work really requires constant advocacy, that we can't just rely on these decisions to be made. It requires people letting others in power know that it's important that these decisions get made. So being here in person actually is really impactful. It's not just wishing and hoping or expecting that science will win. It requires people kind of being on the ground and doing the work. If you want to get involved in this work, Shot at Life is your portal for advocacy. So I highly recommend going to the website, shotatlife.org, and getting involved right away.